Welcome to the Health Insurance Exchange Congress podcast. Thank you for listening. Today we have Glen Shor, Executive Director at the Commonwealth Health Insurance Connector Authority in Massachusetts, and Norm Thurston, Health Reform Implementation Coordinator at the Office of the Governor in Utah. Please describe what your state's exchange looks like.
We actually operate two exchanges at the Massachusetts Health Connector, one for our subsidized program, Commonwealth Care, and the other for our unsubsidized program, Commonwealth Choice. The overriding purpose of each of these exchanges is to make it easier for people who might have formerly had problems finding affordable coverage to find affordable coverage and thereby find and secure their way into the ranks of the insured. Is a state-subsidized health insurance program covering about 160,000 people. We offer state subsidies to help make health insurance affordable for people for adults up to three times the poverty level who don't have access to affordable employer-sponsored health insurance. They have a choice of 5 private health plans, and half of them pay premiums to contribute to the cost of their coverage. For Commonwealth Choice, we are a very active market organizer. We offer 6 standardized health plans for adults, an additional 4 more for young adults, among 7, soon to be 8 health insurance carriers. And we try to structure a shopping experience that allows people to choose and compare benefits on an apples-to-apples basis and thus find the coverage that best suits their needs and their budgets. Finally, I should note, we also make policy decisions relating to implementation of Massachusetts adult health coverage mandate.
Okay, great. And Norm, what about you? What does your state's exchange look like?
Our exchange is a technology backbone that allows us to implement certain features of health system reform. Currently, that backbone focuses on 2 areas: connecting small businesses with a defined contribution health plan and also connecting individuals with options that they have to purchase private insurance. And we have obviously planned some developments down the road, but in terms of the ones that we do have today, that defined contribution plan for the small businesses is probably the most groundbreaking, if you will. And that policy allows small businesses to come on, allow their employees to choose the plan that works best for them, and it allows the employers to simply contribute amount of money so that the employees get what they want, but the employers are still supporting it with the funding. And so that's kind of a critical element for us, is to be able to provide something of value for small businesses so that their employees can have more likely access, more consistent access to health insurance that meets their family's needs.
Great. Glenn, what made Massachusetts decide to establish an exchange?
The creation of the Health Insurance Exchange in Massachusetts, the Massachusetts Health Connector, was one part of the state's overarching health coverage expansion initiative enacted in 2006. While there are many components of that health reform initiative, all in one way, shape, or form entailing shared responsibility among employers, insurers, providers, consumers, and government to achieve coverage at near universal levels in the Commonwealth. The creation of an exchange was was an important component of this. The vision for an exchange, in a nutshell, is to serve as a marketplace that facilitates access to affordable health insurance for populations that might otherwise had trouble securing it. We've done that, among other things, by putting affordable coverage in the hands of lower-income adults who, without state subsidies previously, would never have been able to afford coverage, and who frankly have constituted a very significant portion of the uninsured in Massachusetts. We've also done it by creating a Commonwealth Choice program, which I mentioned earlier, makes it easier for small businesses and individuals to find a wide range of choices of affordable coverage options and choose coverage that best suits their needs and budgets. We offer them not only choice, but a very streamlined, simplified shopping experience that makes their choices transparent and empowers them as shoppers for coverage.
Okay, Norma, what made Utah decide to establish an exchange?
In the very beginning of our discussion about health system reform, we realized that technology would play a major role in helping bring consumers back into the equation, and being able to use especially a web-based tool to help people get connected to the information that they need to make informed healthcare choices. And in the case of health insurance, to actually execute that choice electronically, we felt that that was something of value that we could add to the marketplace that would probably not come any other way. So the real decision to establish an exchange was based on this recognition that technology could fuel the consumer's participation in the health insurance reform or the health system reform as we envisioned it for our state.
Glenn, how long did it take for you to go from ideation to implementation?
Our first employee was hired in June of 2006, and we had created and begun enrolling people in one of our coverage programs by October 1st of that very same year. And by May of the following year, our Commonwealth Choice program was up and running, and we were in the thick of making key policy decisions to implement the state's adult health coverage mandate. So pretty much the connector's been running at full speed from the get-go. It's almost as if, it was a ready, go, set. And it's been a exhilarating, interesting ride from the very beginning.
Okay, Norm, how long did it take for you to go from ideation to implementation?
It took approximately 2 years. We had the idea of some sort of an exchange in about 2007. By the time we got legislation enacted and kind of got that reformed, it took us, another year or so to get that ready to go. But by the summer of 2009, the exchange actually started providing services to the consumers to help them be able to make those choices. But in reality, we're not anywhere near done. We have a lot more building that we need to do in terms of getting ready to implement all of the other features of health system reform that are still coming online year by year down the road.
Okay. Glenn, what are some of the strengths of the exchanges in Massachusetts?
We have a great web-based shopping experience in the Commonwealth Choice program. Shoppers can punch in a few demographic details, where they live, how many people they're shopping for, their birthday, and within seconds they have side-by-side comparisons in a clear, concise, easy-to-understand format that gives them knowledge and tools to make the decision best suited for them. We recently added a provider search function that now allows people to shop for plans by the doctors and hospitals they want to see. So we're getting better all the time. We've been a force for innovation in the market, too. Our Commonwealth Care subsidized health insurance program is very much based on market-based principles, health plans that do interesting and creative things to offer good coverage at lower prices, have great incentives and opportunities to gain membership. In that sense, the program has spurred health insurers to experiment, for example, with narrower networks, enabling them to offer still adequate networks to give people access to the care they need at a lower price point. We are, I think, one of the state's principal laboratories for the ability of narrower network health plans to deliver more affordable coverage that still ensures that people have access to the care that they need. We're proud of the transparency of the Health Connector. We're very proud that decision-making about our programs and our policies occurs in public at monthly board meetings, and we are very proud of the collegial, consensus-driven approach of our Connector board. They have diverse perspectives on key program and policy issues before the Health Connector, but they've managed to debate competing perspectives civilly and come to common ground with a string of consensus decisions about how to implement health reform through the Health Connector.
Great. And Norm, what are some of the strengths of the exchange in Utah?
I think one of our primary strengths is that our exchange is built in almost exclusively with private sector partners that we're able to help them come together and bring services that they're already offered in the private sector and be able to facilitate the marketplace that already existed in our state. On top of that, we were able to create a new type of a market space for private companies to operate in, the defined contribution system, that creates a significant value for the small employers. I think that's critical that we're for our marketplace, it's the right thing for us to do to take advantage of the existing private sector and their strengths and be able to just be the market facilitator. And so we're not creating a new government entity that's going to extend out into the insurance area. In fact, one of our goals is to build as much as possible a facilitation or a market space where private companies can come and can compete and can sell their product, and where consumers can come and find the product that best meets their needs without having to have as much government involvement as you might expect.
Great, thank you. Glenn, what do you wish you would have known before establishing an exchange?
We've learned as we've gone, and that's always been the expectation. We have continued to learn more and more about consumer preferences. We offered, for example, from the inception of the Health Insurance Exchange in our Commonwealth Choice program, We started out with an extraordinarily wide variety of health benefit offerings. We obviously aim to give people choice, but the response that we got in focus groups and other forums for consumer feedback is that the degree of choice was overwhelming. In response to consumer feedback seeking a more comprehensible shopping experience that still had adequate choice, we restructured the shopping experience to reduce the number of plans and standardize them while still offering a wide range of benefit offerings and carrier offerings. One thing that we've learned as we've gone a little bit is, the state's estimates of the number of uninsured have been refined, and we've accordingly been better able over the course of the life of the program to project likely enrollees in our subsidized Commonwealth Care program. We've always expected that we would learn as we go, and we certainly haven't been disappointed. But one of the strengths of the Massachusetts model is, that's not taken as a sign of failure. We're always striving to incorporate the latest information to try to do our jobs even better.
Great. Norm, what do you wish you would have known before creating an exchange?
I think the biggest thing that I would have liked to have known is that we were going to have to deal with federal health reform at the same time we're dealing with state health reform. That turns out to have been sort of a surprise, a midstream surprise to us. And now we're having to kind of rethink a lot of our approaches to things to kind of adjust to that new target. So I wish I would have known that was going to happen from the very beginning. It would have made our job a lot easier. Another thing that I think would have been nice to know before we established the exchange was a little bit more about how the broker community could be used and could be more effectively engaged in the process. I don't think we fully anticipated how critical they would have been to the success of our exchange.
Great, thank you. Now, Glenn, to you, and Norm, also to you, do you have any advice for states that are just starting the process?
I wouldn't pretend that there's any one best way to do it for all 50 states. Each state has to, first and foremost, know their audience, the uninsured, of course, and the insured who are looking for better options in terms of affordable coverage and a good shopping experience. I think doing the best that you can to simplify the experience for people looking for affordable coverage will be to their benefit. Get the word out to everyone that you're in business and that you're here to help them. Closely collaborate with key stakeholders, listen to their ideas and take advantage of their resources. Be flexible. Don't think that after you're up and running that you're done. The work is really just beginning. Improve on things you do well. Look for new solutions to things that you could be doing better. I think these are probably words of advice for any successful enterprise, and it's certainly the case for health insurance exchanges as they spring up throughout the country.
Some of the things that we would really encourage people to do is definitely understand your marketplace, understand what the problems are, and develop a solution that's tailored to those problems. But recognize that solution has to be scalable. It can't be based on manual processes. It can't be based on paper and people doing data entry. It really definitely has to be automated and be able to handle a large volume. It's also critical to keep as much of the existing market intact as you can. Most states will find that they have a lot of people who are insured and they want to keep them insured the way that they're currently insured, and so you don't want to design something that interferes with what's already going on. And then in terms of technology, making sure that you reach out to private solutions and do a lot of beta testing to make sure that the private solution really does what you want it to do. And it's going to take more time than you think. It always will. And just plan on going slow to make that work.
You can hear Glenn and Norm present at the Health Insurance Exchange Congress taking place on November 9th through the 11th in Baltimore. We hope to see you there.